everyone, welcome to Crowns and Sashes. It is Bowel Cancer Awareness Month. So today I'm speaking to Charlotte. She knows firsthand what the effects it has on personally someone who they love. Hi Charlotte.
Hi everyone, thank you so much for having me.
You're very welcome. Could you tell everyone who has battled bowel cancer that was close to you and the effects it had on you and your family?
So it was actually my granddad that had bowel cancer. Unfortunately, he did pass away from it. It was quite a shock to everyone because he was always quite fit and healthy.
Right.
He had his own allotment, very like that kind of era guy. Every day he was down in his allotment doing his fruit and veg. Did smoke a lot though, so that probably was one of the triggers for it. But it was very, very active, and we'd already lost my grandma, called her Granny P, which was his ex-wife previously. So when he got diagnosed, obviously it brought back all the Granny P.
Yeah.
Well, my dad and Auntie were become orphaned. It was just a really, really tough time. It was very difficult for us all. So.
How did he deal with his diagnosis?
He did the typical English thing, carry on.
I'll be fine.
I'll be fine. I'll stop smoking, it'll be fine. But he did try his best. It lasted quite a while. But unfortunately, it got to the point where they couldn't do anything. So
what were the symptoms for him to make him go to the doctors?
So it was, I know no one really likes to talk about it, but when it comes to cancer, we have to talk about these things. It was a lot of tummy pain when he was eating, and then it was quite a bit of bloating. He lost quite a lot of weight, and also the typical sign, which is blood in poo, persistently blood in poo. So he had to go to the GPs and have all the tests. Then it was bad news by the end of it.
So if anyone has any of these symptoms, please go to the doctors, because it doesn't mean you have to be of a certain age to get it.
No, predominantly it's people over 50. So 9 out of 10 cases will be someone who is over 50. But just because of the statistics, it doesn't mean that if you're in your 20s, 30s, 40s, you're not going to get it.
No, exactly.
A lot of the time, if you do have any of those symptoms, it is probably going to be something else. So a lot of the time, blood in poo can be, if you're anemic, as daft as that sounds, you can have a deficiency. So that can be part.
I didn't know that.
Yeah, you can have a tear. There's quite a lot of things it could be instead of bowel cancer. But obviously, you do need to get it checked. Because early diagnosis is the key, because bowel cancer,
definitely.
And it is a curable cancer. But it is one of the biggest killers in the UK, unfortunately. And not a lot of people think of that when they think of cancer. I think a lot of people think breast cancer.
That's the main one you jump to, isn't it?
And I think because obviously it's talking about your bum, no one wants to discuss this type of cancer because it is a little bit embarrassing, to be quite honest. But, you've got to get rid of that embarrassment. You've got to see your GP if you do notice those changes.
Well, it's a serious issue, isn't it? You need to discuss it. You need to see someone about it. How do you prepare, or can you even prepare for someone who's been diagnosed with bowel cancer and is having treatment?
I don't think you can prepare, to be honest. I mean, I've had so many family members have cancer. Either they've passed away from it. I've been lucky that my dad and my auntie have survived. And for me now, I just go in autopilot. I just try and stay just normal, and just try and cherish those last few moments that you've got. I think I'm kind of a little bit numb to it all, and I know that might sound very cold, but I've been through it so many times. I don't know. It's very strange for me to explain how I deal with it now.
Everyone deals with their emotions in a different way, though, don't they? And when someone's told something like this, everyone is going to react totally different.
Yeah, I'm actually quite like my granddad. I just kind of carry on, and then I deal with the aftermath after the passing.
Yeah, that was my next question. What was it like as a granddaughter watching your granddad go through something like that?
It was very, very difficult. He lost a lot of weight, which was very sad, and he just had no quality of life by the end of it either, and that was a big deal for him, and not having that was very sad.
How long ago did he pass away?
Evie was I'm really, really bad with dates, especially because of lockdown. Evie was about 4 or 5, so 5-6 years ago, I think.
So not that long ago, and you had
No.
a small child as well to keep upbeat for, and
Yes, which was not obviously easy because she doesn't understand. She understands more now. She lost her nan last year to throat cancer, so she does understand a little bit more. But at that time, my granddad died. She's just like, "Where's my granddad with the goldfish?" Because he had a fish.
oh bless, yeah.
Like, I want to see your granddad with the goldfish, and then you have to explain it. And I think that's even harder as an adult having to explain to a child. It's not
And then,
nice.
where can we go and see him? I
Yeah.
want to go and see him. It's the questions that come with it, isn't it?
Yeah, it's very sad, and that prolongs the grieving process as well when you're having to explain it to children because they don't quite understand. So you're having to keep repeating yourself over and over again. So it is quite.
Well, you're processing as well, aren't you?
Yeah, you are, and then I have to deal with her feelings as well, and then all the family's feelings, and it's not nice because I have to be there for my dad quite a lot as well. Obviously,
I was just going to say, what was it like for, like, was it your mum or was it your dad's dad? What were they like? Did you have to hold them up as well at the same time?
Yeah, definitely had to hold my dad up. First of all, when my grandma died, I had to hold him up. I had to be the adult instead of the child.
Yeah.
And the second time around with his dad, he wasn't as bad. I still had to step up and be, and kind of like turn into his mum a little bit, mother him a little bit.
Yeah.
And so, but yes,
it's tough, very tough.
very tough.
I have one last question. What would you say to anyone who has a loved one who has been diagnosed with bowel cancer? I mean, there's no advice you can give, really, is there? But
try not to do a me and try and bottle everything up because you eventually do explode, and that's not very nice. I think the best thing is to try and talk to people, and even if you can't talk to your family, it's very tough for me to talk to my family during the time. Talk to your friends, or there's so many mental health charities that can help you with the grieving process, and there is even grieving charities as well that can help you. Speak to them. Just don't do a me and bottle everything up because it's more damaging in the end.
Yeah.
But
well, you're like a cannon waiting to go off, aren't you?
Yes, and then I just explode, and it's no good for you. But for me at that time, it was the easiest thing to do. But talking is the best thing, and cherishing those moments as well. Try to make an effort while they're still here.
Yeah.
And that's not just for you; that's for them as well. And have those tough conversations. If it is a terminal bowel cancer diagnosis, have those conversations about how they want the funeral, where they want the care to be. Do they want to go into care?
Yeah. Because you don't want to get that wrong. You want to get what they want. Yeah.
So it's all about having an end of life plan in place as well, which outlines everything that they need, just so that they're happy as they can be, and that you're happy as well. Because if you know that their wishes are being catered for, it makes it not easier. It gives you a sense of relief, I suppose, that they're getting what they want. So have the tough conversations with them if it is a terminal illness, but then also talk to whoever you're comfortable talking to.
Yeah, definitely. Was it a long process from like his diagnosis until he lost his life?
It was about 18 months.
So it's not really that long, is it?
No. A lot of my other family members were quite a bit quicker.
Right.
Granny P, she was on and off for 10 years.
Oh wow.
Yeah, she were a little fighter.
She's like, I'm not going anywhere.
I'm not going anywhere. I'm staying. You can't get rid of me. His was quite quick. So, but I have had quicker. Like my nan last year, she went within the space of about 3 or 4 weeks. So,
oh wow.
Yeah, really, really quick. So it just depends.
And that doesn't give you time to digest, does it?
No, it does not. It's not easy, especially in lockdown. Then her final wish was to see Evie, and I had to take Evie to the hospital. We had to have face masks on, and then it was a very, very difficult time. And I just feel so sorry for people that have gone through losing people during COVID. You can't say goodbye properly. You can't do the end of life plans you wish. And it's very, very difficult for people. So but just try and talk as much as possible. That's the best advice, is talking. And I can talk for
you can talk for England.
I can talk for England. I'm very passionate about cancer. That's why I chose it as a pageant platform, and I'm very much like an early diagnosis is key. Know your body, notice your changes, and seek help. there's obviously someone in the news recently who avoided her signs of breast cancer, and now unfortunately she's terminal. So you know, there's nothing else I can say. Go to the doctor.
Just go to the doctors if you think something's wrong.
Exactly. And I will preach and preach and preach about it until it drums into everyone's head. It's so important, people. Know your body, know your changes, not just your boobs, everything.
Yeah, everything.
Your weight, your hair loss, even your skin colour, your moles, everything. You know, you should know your body inside out, basically. And then you can notice your changes, because it's all about early diagnosis. Sorry, I know I keep repeating myself, but it's so important.
You want to get it out there.
Yes, I do. It's so incredibly important. But thank you for letting me.
No, thank you very much. It's been a pleasure, and I'm glad you've shared it with us. It's lovely to hear. Well, it's not lovely to hear, but it's lovely to hear your platform come out from a personal experience.
Yes, and it's not been easy, so thank you for being so nice and understanding. I appreciate it.
You're very welcome. Take care.
You too. Thank you. Bye.
Thank you. Bye.